Intimacy Anorexia and Autism Spectrum Disorder. That's our conversation today. And if this is going on in your life, it's going to be a very important conversation. How do we separate that? How is it different? Well, you need to stay tuned. Now, if you're not a subscriber to our channel, please hit subscribe. There's also a comment box. If you have comments, you can put it there. We'll respond. And there's a little bell. Click that so that you can be informed every time we do a video. We send these out and you can share them and help other people as well. So stay tuned. Intimacy Anorexia and Autism Spectrum Disorder. Now, I was talking to a national expert on this, and I've worked many years with someone who has that and intimacy anorexic. And the question becomes, how are they different? Because when someone has autism spectrum disorder, it's very common for the spouse to want to solve that problem. What's going on? I don't feel connected. I feel alone. And they'll Google and they'll find married and alone. They'll find intimacy anorexic and go, oh my gosh, this is the answer. This is it. Because they go through the criteria. Yeah, they're busy. They blame me. They withhold love. They withhold praise. They withhold spiritually. They withhold sex. They can't share their feelings very well. Anger and silence can happen. Criticism's going on. They may or may not control around money issues, but they feel like roommates. So here's the thing. Whether you're married to an intimacy anorexic or you're married to Asperger's syndrome, you're going to feel some of those very same feelings. Now, there is a huge difference in this. And I want to just take a couple minutes and walk through this because it's very important. With intimacy anorexia, the very definition is the active withholding of spiritual, emotional, and sexual intimacy. And it generally shows up mostly or primarily in the marriage and after marriage. Even dating can be normal, okay? Now, in that, the intimacy anorexic can have pretty good relationships and connectivity with other people as long as they're not married to them. The person they're married to is the one that gets the suffering, gets the withholding, gets the blaming, the criticism, can't do anything right, all that kind of stuff, but it's in the marriage. It's a relational disorder. Now, when someone has, on the Asperger's side, when they have the Asperger's spectrum disorder, that's actually a disorder. Now, the difference between the two is the disorder is global. Everyone is having these relationship issues with them. Everyone is feeling somewhat like there's something off or disconnected, or they're not getting me, or they're not having good boundaries and stuff like that. Now, just right there, you can see they're different. One is everywhere. One is only in the marriage. That's how they're different. Secondly, how they're different is with the intimacy anorexia, there is a huge amount of intentionality. They are intentionally creating distance, whether it be through pain of blaming, criticism, it can be through ways of sabotaging you, and it's intentional, and you'll see the patterns. And you can watch a video, Pain for Love, Intimacy Anorexia, Married Alone, and you will feel like I've been in your life, okay? Because there is this intentionality. That person, when they're in the doghouse, or you get to that level of pain where you're gonna leave, they show up for a week or two and they stabilize you, and then they start starving you again. And there's this pattern that goes on and on throughout your marriage. Now, with Asperger's, even though you're feeling very much the same feelings of a disconnection, a lack of emotional intimacy, there's no intentionality. They're not intentionally trying to create pain. Now, I'm not saying there's not pain, there is. But they're not doing it to be distant. They're not doing it to be safe, much like the anorexic would do. They're not motivated like that. It's kind of as if there is a genuine limitation there. Now, they can mature some and grow some, but it's there. And it's not mean-spirited. They're not trying to hurt your heart. Although you do get hurt because there is a legitimate limitation there. What's interesting, and this is where it kind of gets unique, because the tools that we've developed on intimacy anorexia, even the support groups the dailies, some of the attachment exercises we do in intensives here at Colorado Springs really work. And if someone has Asperger's, if they actually create those disciplines in their life, the spouse is alleviated to some degree. There is more intimacy, there is more connection. They do have a sexual life that stays consistent. And the wives or husbands generally feel like the person's trying, they love me, they're doing the best they can. And that is totally different. Whereas if someone's an intimacy anorexic, if they're doing intentionally, they may or may not be trying to get better, and they can stay in pain. But over here, honestly, I don't think I have one case with someone with Asperger's disorder where if the person tried, that the spouse wasn't able to accept it as a good thing, that they can do these tools, that they can share their feelings, that they're willing to have sex on a regular basis, date on a regular basis, and feels a little bit more normal, and they can accept the limitation as a limitation without giving it the meaning of intentionality and intimacy anorexia. And it's a big difference. Now, don't go on the internet and try to find out if someone has Asperger's. I mean, it's fine to do some basic research to think, is this what's happening? And it might be. But go, find someone in your city or in your state that specializes in Asperger's, okay? And have them do a really thorough evaluation to see if that's what's going on. And if it is, then relax a little bit. They could still benefit by the tools that the intimacy anorexia treatment provides. But don't go down the road of they're trying to intentionally hurt me, they're intentionally trying to be cruel to me. That is something the intimacy anorexic might do. Now, if you go through all that and they're not Asperger's and they still fit the intimacy anorexia criteria, you might really consider doing intensive, getting a phone counseling, getting a Facebook group, doing something that can help heal that, because that feels very painful and very alone. And there's treatment for that if the person's willing. Now, they have to be willing. If they're not willing, nobody can help them. Okay, but these are two separate things. So don't assess your spouse by yourself. Get a professional opinion. Just like if you had a child who had limitations in an area, you would take them to a specialist, see what's going on, and then get a treatment modality that works. The same here. Do that, find good help, and there is really good help for that. And if that is not the path, then maybe revisit intimacy anorexia and see what's happening. And I have seen thousands of clients, and I've had the situation on both sides where a husband or wife has assessed their spouse as Asperger's, and they come in and we do the psychological test, and there's no evidence of that. It's 100% intimacy anorexia, and it's willful. And we've had the other situation where, they read the intimacy anorexia, they watched YouTube on that, or they read the book or video. And it's like, oh my gosh, that fits so good. And then I get the psychological test, because when they do intensives with me, they automatically get a psychological test, or they can, with someone else, they can order that. And it's like, oh my gosh, this person has Asperger's. This is something we need to get further assessment on, but we can't put that intentionality on that person. The tools still work, so it's still a good investment, but it's not exactly the fit. So please, if this is something that you guys are dealing with, get the best information you can, get the best help you can. And if we can help you here at Heart to Heart, our number's there on the screen, our email's there, there's a comment box there. We respond to you as soon as we possibly can. We do want you to have a great relationship, have a great marriage, as best as you can. But please get the best information and then make a path for healing.